I hate that word. And the reason I hate that word is because I think of a journey as something cool.
What's a word you would use for it?
Nightmare. The first 6 months was a struggle. I soaked the bed. Every cancer is different and how your body reacts is different. I say I was lucky because I just had surgeries. Yeah, recovering from surgeries is not awesome, but I recovered from them.
Afraid to say that we miss our old self. I'm Dr. Beatrice Seguin, PhD, and you've landed on my podcast this time of the month, your trusty sidekick to the midlife roller coaster. Let's own this midlife magic together. One of the most important things about this time of the month is community. And that does not just include our providers, our experts. It's the women going through it. Midlife, perimenopause, menopause, their stories. Because if we share stories with them, hopefully we recognize parts of ourselves. So today I'm really pleased to have as my guest, Charlie DeSantis. She is the radio host of the morning show on Cool FM 107.5. Welcome.
Thank you. Happy to be here.
So how'd you go from radio in Toronto, I assume?
Yeah.
To radio in Barrie?
The kids were young. I had kids, they were young. And, for an on-air personality, most of our goals are usually morning shows. And, the bigger the city, the harder it is. It's more competitive. I had some morning airtime, but if I really wanted to do something worthwhile, it would have had to be in a different market, which it just worked out, right? So,
well, Barrie's lucky to have you.
Thank you.
You're a piece of humor in the morning.
It's a great place. It's no regrets. I actually didn't think I would love it as much as I do, but you find a home within a home, right?
What's your favorite part about being on the radio?
I like being able to make people laugh, because I remember commuting, and again in the late 90s, it was Mad Dog and Billy.
Yes.
And for those however many minutes you're commuting, you just forget about your life. Like whether your life is great, whether it's garbage, whether you just are not looking forward to a meeting or something, those few minutes, you just forget about it. Yeah. And that's what I really sort of liked about the idea of doing radio. So
I feel like radio will always have a place, because it does, at least as a listener, it's like you have a friend with you in the car, on your walk.
Yeah, and we have a lot of people calling us, and it's great because, they'll be like, oh, how's it going? And, sometimes, they'll flirt with me, they'll flirt with Dale, or they'll just, it's just a fun job. Like waking up and getting paid to just ramble, just talk, just say whatever comes to your head, and hopefully people find it.
It resonates.
Yeah, funny, hopefully. So
I'm new to the podcasting world. I never thought I'd find myself here and on camera. That has definitely been a journey for me. But I have to say that I do pinch myself, because how lucky am I to sit down with people and have conversations? So new for me, but I can see why it's a good lifelong career.
It's fun.
Yeah, it's fun.
Let's just relax.
Let's relax. My pants aren't right either. I'm so glad you did that.
Holding my legs like that hurts my butt. Okay.
I find all pants I have issues with in my menopausal life. And before we get to that part of the conversation,
that's super fun.
It's like so much fun. I really admire the fact that you've been quite open with the public in terms of sharing your journey. So do you want to tell our viewers who may not know you a little bit about your breast cancer journey?
Sure. Number one, I just want to say, just because it's one of my things, and I understand everybody calls it a journey, I hate that word.
Okay.
And the reason I hate that word is because I think of a journey as something like something cool, like something like, I'm going on this journey and I'm going to like climb to the top of something, or I'm going to, go I don't know. I don't know. I guess maybe they just created that word because it is such a long process, right?
What's a word you would use for it?
Nightmare.
Okay, that's fair.
Am I allowed to say that?
You're totally allowed to say that.
No, you know what? In fairness, I don't want to come across, my cancer, fortunately, was not nearly as bad as other people's. Is right. So, but again, it's what happened to me. I found a lump, and my bestie next door is a nurse, and I called her over, and I just said, "Hey, what's this?" And she was very That's probably nothing. Let's just, make an appointment with the doctor. Let's get this looked at. And, so call your physician, then they will refer you, right, for your mammogram. It wasn't that bad. Like the process was about a month, right? So it took me 2 weeks to get to my doctor, a month to get to the mammogram, 6 days to get to ultrasound and like a
biopsy?
A biopsy, thank you. And then they put a little thingy in me. And from there, 5 days to tell me that, we referred you to the cancer unit and, one of the doctors will be contacting you. I'm like, oh, great. And I remember my first response. I was actually near Ottawa with my son, who's then a little kid actor, and he was making a movie. And my doctor called and said, can you come into the office? And I said, well, no. I said, I'm in Ottawa for the next few weeks. And he's like, okay, well, he explained, your file's been referred to RVH into the cancer unit. Can you get to RVH next week? I'm like, no, so, I think I had some time to process it by myself.
Okay.
Called a couple people that I trust the most that I knew could handle it, just to kind of decide what to do, who to tell, how to go from there. So for me, I have BRCA. So again, most people will know BRCA from Angelina Jolie. Her mother had BRCA. She has BRCA, which is why she chose to remove her breasts and like all of her reproductive organs, because the probability of the cancer becomes much more.
Yes, you're much higher risk.
And even with BRCA, so again, the boobs came off, all the reproductive full hysterectomy, that's all done. I still have a greater risk at stomach cancers, skin, other things like that. So
there's a lot to unpack here.
Yeah,
how did you feel? You're in the throes of raising one, two, three now,
like a bonus child. Yeah. You know what? I literally, the first thing that came to my mind was, I don't have time for this. I'm too busy. I have things to do. It's also a little bit of just trying to like get through every day. You're just like, I have this to do today, so I'm just going to go do that. And but I have a doctor's appointment. Okay, so I'll go do that. And then they're going to schedule.
You worked through your treatments?
For the most part. So for me, I just had surgeries.
Okay.
And I was lucky enough. I should have probably taken more time off after I had the double mastectomy, but I was back in my radio chair within 2 weeks. Bosses were freaking out. They were like, wait, I don't think this is a good idea. And I'm like, well, no, I'm sitting. I just need my heating blanket, which just, helped with comfort and whatever. And I was allowed to come back. The hysterectomy was different. I had to take more time off, although they set up a studio in my bedroom for me.
And it's something you wanted to do.
Yeah, because I think that was part of what I needed to do to heal. Like, I just had to move on it. Like, let's go. Let's get past this. Like, and I think, too, the faster for me that I moved on, the less it affected everybody else, right? It's like, oh, she's fine. She's normal.
Which is such a mom. Woman thing.
Yeah, like, you have your kids take things differently. So I have one child who was just like very upset, ironically the older one, and the other one, the younger one, who's more pragmatic. He's like, okay, but wait, so they're gonna do the surgery, Mom, and then you're gonna be fine, right? And I'm like, well, yeah. He's like, okay, I'm like, huh, whereas the older one every day in my room, right? Comes home from school, he would crawl into bed with me, he would come check on me 3-4 times. Whereas the younger one would only come if he needed something, because he's like, don't worry, Mom's fine. So I just wanted them to feel normal, and not be worried or scared or anything like that, right? But I think truthfully, cancer is worse, in my experience, from what I've gone through. It's worse for everybody around you.
I'm curious why you say that. Like, why is it worse for everyone around you?
Because I think they feel helpless. Or they feel useless, right? Like, what can I do? How can I help you? Obviously the ones closest to you, they want to take your pain away. You have moments. Yeah. Like, I remember the week or two leading up to the surgery, I didn't tell the children until the weekend before. I didn't go to air with it until the Tuesday before my surgery, which was 4 days later. because I just didn't want to think about it too much. I would walk the dogs and like have mini meltdowns, by myself. Just those kind of like, oh God, and it's just, what I think the problem too is it's the fear of unknown, right? Like you don't know. And I think that is why a lot of women and men don't go and get
like
checked.
When you find a lump, for example, or just in general,
just
the
screenings. Like right now, the screening process has become so much easier. And there is a hotline now that you just call.
Self-referral.
Yeah. And they will get you in within a week. Like some days they've got availability that day. And I think it's the fear of not knowing. I think it's the fear of women being busy. I don't have time for this. I have so many other things to do. I have laundry. I have this. I have to go get my hair done. Guess what? That's the thing. If you make time to get your hair done, right? Every month or however long, your nails, it just takes a few minutes. They've got new machines now too. So I think that's something, because I always say to everybody now, you're good until you're not, right? And everyone's like, no, I'm fine. I feel fine. I feel great. Yeah, sure. Me too. I felt great through the whole thing, really. It was the surgeries that made me not feel great, right? It was the recoveries. Fortunately, I had no radiation. I had no chemo. So again, I was very fortunate because that I know is a very, very rough ride for a lot of people. And I can't imagine what that is like.
I mean, the process is individual, and it's got, I can't imagine it being easy for anyone. When you were going through this, did anyone explain to you what was going to happen? Like, what was the consequence of the treatment you were receiving with respect to menopause?
Well, yeah. So with the breast, it was, they both have to come off, or like for sure you're going to get cancer in the other one. Like that was, They just said that from day one. I'm like, okay. And then my genetics doctors then informed me I'm going to have to do a full hysterectomy because more than likely you probably already have tumors, lumps, something growing. And sure enough.
You would have been young. You don't need to disclose your age unless you're comfortable.
No, it's okay. I was 42.
Okay. So that's young.
Yeah. And so, I had a little cyst on a left ovary. So initially the doctors were like, well, we'll just do the one side. And for this reason, I think, because they wanted to minimalize the menopause. And then my cancer doctor said, no, get it out. Everything comes out because my risk was too high. So one nurse, my pre-op, told me just before I was doing the hysterectomy, and she kind of looks at me and she's like, okay, so within 48 hours, you're going to get really hot. And I was like, what? And I heard of hot flashes, but you don't quite get it. And she's like, well, you can do a couple things, like keep some cold face cloths by your bed. You can put them on your wrists and behind your neck. And you can try to, because again, with the BRCA gene, my cancers are manifested with hormones.
Correct. So you're not eligible for some of the hormone therapy
to
manage menopause. Yeah.
Nothing.
That's not off the table.
Totally off the table. So the first 6 months was a struggle, just figuring out what to do. I soaked the bed. It was so gross changing. Speaking of, I'm dying. Here we go.
Put it here. Yes. Let's go. Do you need a fan? We need a fan. No,
I'm just whatever. This is my life now. It's just so silly, isn't it?
It's
nobody can prepare you for this.
It sucks.
Yeah, it does. It is, and nobody can prepare you for what this is. They can say, oh, the hot flashes, until you feel like your body is on fire from the inside.
Yes. And instant, and you don't know when it's going to happen.
Yeah. So now, fortunately for me, I've been allowed to take a couple of medications that are not hormone driven that have helped.
There are options now. That's progress.
Yes, there's actually a brand new drug that's just come to market over the last 6 months in Canada. So
is it the fezolinetant?
I don't know.
Okay, we'll put it in the show notes only because I think it's important to share.
100%.
There are so many breast cancer or hormone responsive cancer survivors that don't know their options or aren't told.
So the other thing with this is that a lot of doctors right now don't know about this
Yes.
drug. So my oncologist, who's brilliant, Dr. Rask over at RVH, she was the first one to try to get me to this drug. It's a very costly drug. Most women will take it twice a day.
Okay.
It's a $40 pill. So you're looking at $80 a day. Hopefully, people's coverage. If you are going through treatments, I believe you are eligible. I know that the cancer centers do have, what's the word? They have programs like they can help compensate for those medications and stuff like that.
Can you imagine if you don't have access to that and you're a breast cancer because of cost issues?
Yeah.
Well, you just named a few.
Yeah.
Doctor doesn't know about it yet.
Yep.
Or you might know about it, but what if you can't afford it? So I'm not sure if all cancer programs offer it, but I'm glad to know that there is some kind of
RVH is incredible. There's a reason why they're like ranked 2 behind Mount Sinai. I mean, the staff there are incredible. I'm from the nurses to the people who take the blood to the technicians. Like the staff at the cancer center they're just lovely. They're just perfect.
Full disclosure, I'm a little biased. My husband's a doctor, cancer doctor.
Well, there you go. See, so
we're big love, but I'm so glad that you felt supported, at least from that not just that perspective, but in that.
Yeah.
So the medication helps a little bit.
It does. It's much better. Like I'm not soaking the bed anymore.
Yeah.
So that's something. It's definitely, I'm sleeping better. And again, part of, menopause too is like, you need to sleep.
Yeah.
And you can't. Some days you just lie in bed and you're like,
yeah.
And there's no reason for it. You're like, I don't understand. I'm exhausted. Why can't I sleep?
I call them monkeys in my head.
That's it. And it's just, I just feel like it is what it is. Life is what it is. But I just think it is just so unfair that, we just, have to deal with this on top of
what? How many things? Raising
kids. Well, first there's periods, right? So when you're 12, you're 13, you're all awkward and that's gross and you're messy. And, until you're like late teens, you actually figure out how to deal with your period, without it being a, bloodbath, for lack of a better term. And then, then you have your babies.
And that's a mess.
And that's another mess. And then your
Nobody
body.
told me I was going to be wearing Depends after giving birth.
Oh, yeah. I know. Nobody tells you. Yeah. I remember that they handed me a squirt bottle. Mm-hmm. They're like, okay, so this is for washing. I'm like, washing what? So, yeah. And then you just when you get to that age where I think my children are teenagers, I'm like, oh, maybe I can relax a little and sleep more. And no. It's a whole new world, yeah.
And I mean, there's that layer too, because you have this whole period, like perimenopause. It's a workup. Yeah. It's its own chaos, but to go into menopause overnight.
And that's basically what they said. It's going to be like a truck hitting you, it sure was.
It sure was.
But I feel for my friends too, because I'm watching a lot of them, and they're confused. And they're like, okay, so I think it's happening. because I'm I'm so hot at night and I can't sleep. And I don't know what's going on. And I just want to punch my husband in the face. And I'm like,
sounds right.
That's about it. There you go. You're welcome. But I think now I'm really excited that I see more people speaking about it and talking about it. And because nothing was ever a thing growing up, right? You had your period. Oh, it's no big deal, right? I had my first son in 2008, and I'm 100% sure I was postpartum. It was rough. And I got that. That's normal. You're good, right?
And that's it.
Just go.
Pat on the back.
That's what happens, right? Just you have a baby. It's normal to feel this way. You're exhausted. You're overwhelmed. Don't worry. It's fine. And then you get this now. You have this menopause. And again, oh, this is what happens. This is just the way it is. And you're like, why? Why does it just have to be this way?
Why do I have to just put up with it?
I know. This is just... I'm wearing these jeans because they're loose, enough here, because this is new. This little belly here is awesome. It's like, what's happening, right? So it's just a matter of learning and getting through things, I guess, and just figuring it out.
I feel like just saying it, just sharing it, you're like, I got one too. She's right here.
It's horrible. And, if you're not used to it, right?
You're not used to it.
No.
And it's hard. It's hard to accept it. And, part of it is it I need to love myself and my new self and my changing self. But the other part of you is like, oh, what in the hell?
Yeah, it's like, no, I want to wear my skinny jeans, okay?
Yes.
Like, I would like that. And I would like to, and again, a lot of people say, oh, but you're so thin as it is, or you look great. Well, I appreciate that.
But not for what you felt
what you feel, right? And it's funny because a girlfriend of mine down the street, who's very just naturally just a very tiny, structure, she told me years ago when she was going through it, and she's like, I just want to die. She's like, I just feel so like poofy, and I'm like, and I looked at her because she's just tiny, and she said to me, she's like, it's different. It's like you're imploding, like you're just something is happening, and you don't feel like yourself anymore. And you're trying to figure it out. And I didn't know what she meant until
you're in the club.
Until it happens.
I don't feel like myself club.
No, and I don't think people appreciate that. And I don't think people get it.
No.
And it's a hard adjustment. And sometimes, people deal with it, by eating a lot of cake, which which I actually did last week. And then, or like exercising or doing yoga or whatever,
just plain old feeling bad, like it's their fault.
I know, and that's the worst part, right? Is just the struggle of just trying to, feel like yourself again. But I'm just trying to do those kind of things. I'm trying to take a little more time for me and what I need now. Like obviously, I'm still there for my children and my job but just a few things where I'm like, no, I'm not doing this. No, I'm not going to a family barbecue. I don't want to go. I want you all to leave, and I want to sit here with my dogs in silence. So I've explained to the boys sometimes, because they'll see me just like throwing off clothes, in the kitchen. They're like, Mom, what are you doing? And I'm like, I am on fire. I said, I'm dying. And like, I'll have the windows open and the doors, and it's January, and they'll come downstairs. I'm like, you two, go get a sweater. Go get a hoodie. Because that's where it is. This door stays open until I'm ready to close this door. I would wear a sweater or something. Like I have a tank top on because I knew I was going to like sweat at one point. It's a wardrobe change now too, right?
It's a wardrobe change. So when you go out for the day, are you like, what are you doing? Because I find like sometimes you either what you choose, but like backup plans.
Yeah. Like what are you going to wear? What are you going to bring? It's but these are great, and they don't like stick to you, and there's different variations of them, and they have a bra in there. So for me too, after the double mastectomy, having the implants put in, I call them my government grade boobs because there's nothing. I mean, don't get me wrong. I mean, my surgeon is actually, she's the only surgeon in the country that is a cancer doctor as well as a plastic surgeon. The reality of me is there's nothing there, when you get implants, like they've taken everything out. So it's kind of they're just kind of hanging there, I describe it as like, remember in dodgeball, in gym, and there was always those few that were deflated and you could just grab them and like whip them at someone's head. That's what these are. They're like my deflated dodgeballs, which I'm grateful for, completely grateful for. But it's a different feeling in a bra now as well. So it was actually Jane Pritchard, who I had met a year before, actually. We were just at a charity event together, and she had just released her book, and she had told me about certain bras that would be better and you'd be more comfortable. And she was 100% right. And she said, she goes, they're not going to feel right in regular bras for a very long time or ever. They sit differently. So, I mean, my cancer doctor's lovely. Again, I'm still scheduled to have augmentation if I need it or some correction. Because it is different. I mean, I still have like aches and pains and things like that, but that's all minor things now, right?
It is minor, but it's real.
Yeah.
And it's part of you that you've lost. And,
I know. I kind of make fun of myself at first because I was like, okay, so I lost my boobs, and then I lost all like my reproductive. I'm like basically like an ick. Like what's here? It's a little silly, but again, that's how I deflect. I make jokes,
Well, sometimes humor helps.
Yeah.
But sharing the story, honestly, I feel like so refreshing because these are not things we talk about very much, down to like what bra to wear. Yeah. What tops help us with our night sweats, anything else you wish women, knew.
Yeah. I just wish there are things we can do to try to help ourselves. I know like swimming helps a lot too, like colder water. But, and there, you know, obviously alcohol's makes it worse, but so does pasta. So.
And we love pasta.
We love wine. Well, at least I do anyway. So.
Yes, you're not the only one. It's hard. It's sad.
I did learn that like, again, like with menopause, your body isn't able to metabolize certain things anymore, right? So
many things changes. Oh my God.
So many things change.
Anything positive? Anything positive to say about the menopause?
No, not at all. No,
Nothing
I really,
so far?
but can't, no.
I mean, for me, I do think I give less Fs.
There's that.
We just swore, so I don't know why I'm saying yeah, but I do.
Yeah. No, there. Okay.
Give
Yeah.
less.
Okay. Yeah. Okay. So okay, if you want to say that. Yeah, I care less. I guess. Yeah. Like I'll do one right now, and then you can do one. I do not care about group chats.
Oh my God. Okay. I do not care about contributing a snack to the team sport event.
Oh, that's a good one. That's a great one.
My husband can go buy it and bring it.
Yeah. Done. That's a good one.
Charlie, you mentioned that the hospital, the staff, your healthcare team were amazing.
Yeah.
I'm really glad to hear that because not everyone has a positive experience. Who else was key? I don't want to use the word journey. Like I totally have a new appreciation for what you just said. So like for the process.
That's just me. Yeah. Process is a better word.
No, but it's true. Like it makes it sound like
I guess
we're going through this field.
I think the idea of the word journey too is like the courage of it, right?
Yes.
But I do very much appreciate that. But the word just kind of irks me a little bit. But you know, there's lots of my co-host Dale, you know, from the morning show. Like he's been like sort of my sort of rock where we just joke about things just constantly. Right now, the hot flashes. The studio, the irony of the whole thing is he always used to have the studio cold. He's like, well, you can always put on a sweater, you know? And
now the tables have turned.
Oh yeah, now I'm like ripping everything. I'm like, turn on the air, I'm dying. And so now it's a little funny. So he's been my sort of my I think just because he has no idea what, and he can't, and I think that's good that he didn't try to be anything other than what he was. And he was one of the very few that just kept treating me normally. You know, there is Gilda's Club, which is right across the street from the hospital. And I think the one people don't know, they hear the name, they understand Gilda Radner. That's what it was, you know, why it started because of her, what happened with Gilda. And
I don't know that everyone knows about it. Do you know?
Yeah, so Gilda Radner, you know, obviously from Saturday Night Live, SCTV, you know, she went through a cancer, you know, and it was pretty rough. And she said there was nowhere to go. There was nowhere to turn for help or questions or a place that was just for her and other people like her. So years after her friends, I believe, decided to create this, you know, this Gilda's Club. And I think what people don't realize is we have an incredible Gilda's Club here, and we are so lucky to actually have one and have a red door.
Yes.
It just celebrated 15 years. And Gilda's Club is not only for like if you're going through treatment, if you're good like me right now, the door is open and they offer so many programs. You can just like hang out, you can cook, you can read, you can do yoga classes. There's all kinds of programs, and they're actually staffed with therapists. Yes. You know, if you find out, for example, in the hospital that you've just been diagnosed with some sort of a cancer, you can literally walk across the street and open that door and yell,
and that's amazing.
And they'll be like, okay,
we got you.
You know, and I mean that's what Gilda's Club is that sort of that support system that I don't think a lot of people realize. And I think it's a little silly to say, but you know, if you've gone through it, it's the club that nobody wants to be a part of, right? So if you've gone through a cancer,
but you're thankful for it.
Yeah, you understand, right? What the other person has gone through.
Thank you for mentioning Gilda's Club because I don't know that everyone does know about it.
Yeah, I think the name is there, right? But I think it's the actual what they do and what they're for. And they're not just, again, for cancer patients. Like the family can come in. There are days where you can come in with the kids and there's puzzles and there's therapists there and there are support workers to kind of guide you through, because again, every cancer is different and how your body reacts is different. Again, I say I was lucky because I just had surgeries, and yeah, recovering from surgeries is not awesome, but I recovered from them, right? So I was able to, move past it. I mean, again, with the exceptions of little aches and pains here and there to remind me, oh, by the way, I'm fine.
Charlie, I hope you don't mind me saying this, but as I hear you talk,
Yeah.
I almost detect not an apology, but kind of like, hey, my cancer is not as bad as someone else's cancer. Like this, we do that, don't we? With all, whether it's like my depression's not as bad as that depression.
I think because you just want to feel normal or
grateful too.
Yeah, and not diminish what somebody else. It's the same thing. It's it could be worse, right? It's the same thing, right? It could be worse.
Yeah. But your journey was yours.
My journey. It was mine. And I had a complication last year. I had an obstructed bowel. So that was awesome. Oh my God, that was the worst thing ever. That was worse than the cancer surgeries. It was just, things happen, right? And that's not just, selective to cancer. That could happen to anybody, I find myself back in the hospital for a week and trying to recover from that. And that did suck and it was horrible. But then, you get past it and you just try to move on, I think. And that's why I say, well, it could be worse. And, other people are still going through it, right? Like, and some people are good for 2 years and then it comes back. And, I'm a little nervous right now, but I had a checkup. I have another one in February and oncology on December, because I'm almost at that 2-year mark. And I hear that's when people start to freak out, or you hear that's when certain cancers come back.
There's something you tell yourself, or do you just live in the now? What's your, how do you cope with that?
Be the way I want to be. I just want to live the way I want to live. I want to be a size 2. I want my inner thighs not to touch.
Oh my God. Can I just thank you for saying that? It's okay, right?
I'm lying in bed and I've got a pillow and I'm like, it's so gross. And I'm serious, because it's just this horrible feeling for me because they never used to.
Yes.
And now they do. And
I feel
would like that to go away.
Say that. We're afraid to say that we miss our old self.
Oh, I'm not.
You just have to be happy. Just be happy to be alive.
All that's great.
I think we have to do what feels good for us, right? And I had a great conversation the other day about it's not so much we get judged for the choices. We have options. Yeah. Why are we always judged for our individual choices? Why does that happen? Why do we care? Why do we care about what someone else is doing, or should
I'm a little naive to that, I think. Yeah. Sometimes where I think I don't think I ever cared really, for the most part. I don't want people to think. Can I have
a dose of that?
I know. I don't want people to think badly of me.
I think we could all use a little more of that. Whatever feels good to us, we should just go with it.
Yeah.
How's your perspective on life? How has that shifted?
I definitely am trying to do more things that I want to, and meaning not put them off. Just that, I love concerts, but I love seeing concerts in other cities.
I do have a question. One last one.
Okay.
Charlie, what makes you feel beautiful?
See, I knew you. I know, and I remember, this has been stewing with me for a few days now. Well, size 2 and a thigh gap. But besides that, no. You know what? I think, just knowing that the people around me, or that they know that I have their best intentions at heart, and that if somebody asks me to do something, that they know they're gonna get that from me. I think that I pride myself on being loyal and very considerate and respectful of others, and I think that would probably be my answer.
That's a beautiful answer, and I know that you sharing this story right here sure made me feel beautiful.
Oh, look at you. I'm not a mushy person, so I'm going to come up with something inappropriate in a minute.
I'm mushy, and that's okay.
I'm totally the opposite. Thigh gap. Bye, Gap.
Thank you so much for coming.
Oh, thank you for having me. It was fun.